different hashtags being used around this grant, people talking about what they're using it for. And Mr. Magasela was right when he said food has been one of the primary goods that people are spending this money on. Somebody who has been able to really make it go a lot further than many of us would have thought is Matwalisa Lehwahwa, who is from the Free State, and she's one of the beneficiaries of the 350 SRD grant. I'm going to ask her to perhaps tell us a little bit about her story and how she has been using the grant since you started receiving it. Matwalisa, the floor is yours.
Greetings. My name is Magalesa Lekhwahwa, and I am based in Bethlehem, Free State. My business name is Lady Q Designs. I started my business with 350, the relief fund. And when Mr. Cyril announced that we'll be getting the 350, for me, it was a breakthrough because I couldn't find jobs because people were being retrenched because of the world pandemic. So to myself, I told myself, you know what, this is a breakthrough for me. I have to do something with this 350. This pandemic, it's not going to be something that's going to be permanent. It's temporary. And I need to see that I make use of this 350. So I decided to start my own business by starting small and growing big. That's how I started. And yes, that's how I started my business.
And tell me a little bit more about how you actually started your business, because I think many people's minds, they're wondering, how do you even think about a furniture shop that needs so much resources, that would need so much capacity, and think about how 350 Rand can ultimately get you to where you want it to be?
Well, at first, I did my research. I was avoiding depression because when people said that people are being retrenched, I was like, where am I going to apply? So then that's when I decided, you know what, let me go to YouTube. And I did my research and on how to collect tires and make use of recycling, which is one of the things that I thought, okay, this I can do. And how about I make this recycling thing into a furniture? And I watched, those for I would say foreigners when they make furniture out of used tires. So I was like, I can do this. So with my 350, I started researching on how can I start small by buying a simple stapler. And I was like, yeah, I can make a couch. From here, this is my start. So I don't have to, think big on capital. This is the start. So every time when I went to the 350 post office, I used to tell them that, you know what, I'm going to open up my own business. And they thought I was lying. And I would say, you should come and check.
Wow, that's absolutely amazing. And how's your business doing today?
Wow, when I started, people were like, a girl, furniture, wow. No, you're doing men's work. I would say, oh, okay. For me, it was something like I just wanted to provide for my family and for myself. Because I'm a woman, I need hair. I want to look, all classy. And I was like, you know what? I know it will pop up. People will get to know it. And for now, yes, it's booming. Don't want to lie. It's booming. People are buying. People are making orders. Yes, and from making furniture out of used tires, I also make headboards, and I also do I renovate couches and car seats.
Matwalisa, thank you so much for sharing that story with us. And I think we can all learn an important story of resilience from you and really making the most when given lemons, trying to make lemonade out of it. And you've successfully done that. Let's give her a round of applause. I really think that she deserves it. Well, absolutely incredible. And Magasela, Dr. Magasela, perhaps that's why we need more women to make sure that more women receive the grant the next time, because, you know, money in a woman's hands really goes a very, very, very long way. Let me then introduce our panel discussion and allow us to hear from the experts who are going to be part of this dialogue, and I think really sharing their expertise. Let me welcome and introduce Brenton van Vrede, who is the Chief Director for Social Assistance at the National Department of Social Development in South Africa. The social assistance budget for the country is approximately 190 billion a year. It accounts for more than 12% of total government expenditure and around 3.5% of the country's GDP. Mr. van Vrede started his career in the national government of South Africa in 2004 when he joined the National Treasury as a health analyst. In 2006, he became the budget director for the National Department of Social Development, and in 2011, he joined the National Department of Social Security to focus and pursue on his interest in social security. Please, ladies and gentlemen, just give him a round of applause for me as we welcome him to this conversation. Up next, I want to introduce Ms. Isabel Pryor. Isabel is the founding director of Studies in Poverty and Inequality Institute in South Africa. She's worked as a director at a commercial law practice before moving to work as the Black Sash National Advocacy Manager. From there, she moved to work as a senior researcher at NALEDI, the research service organization of the Trade Union Federation, COSATU, and this was before starting SPII. SPII undertakes both primary and secondary research into poverty and social exclusions and policy analysis in the field of anti-poverty studies, anti-poverty policies, inequalities, socioeconomic and constitutional rights, and also they have a big focus on social protection. So with that said, please allow me to welcome then to the platform today and to this conversation, Ms. Isabel Pryor. We can also give her a round of applause, please. Joining us virtually, as many of you would have seen, today's session is a hybrid session. Let me invite and welcome the final expert that's going to be joining us, Selwyn Jehoma. He has over 20 years of experience in social grants policy development, management and training. He studied government policy at several universities. He is the former Deputy Director General for Social Security. He has visited more than 30 countries to look at their social grant systems and has worked as an international social grants expert and trainer in over 15 countries across the African and Asian continents. He was one of the first at the beginning of the COVID-19 lockdown to write an opinion paper arguing that the government should provide basic income support to those who would be severely affected by the pandemic. He believes that training and skills development is of great importance if we are to prepare ourselves as a society for uncertain and difficult times. Mr. Jehoma, welcome to the program. I know that you've been listening to us from your venue this morning. Let's give him a round of applause as well. So those are our esteemed panelists for today. And of course, Mr. Magasela will continue to be part of the conversation. I'll begin by giving each of you 5 minutes just to really reflect on this research, reflect on its findings, and perhaps even the perspective, I imagine, Brenton, for you. We've heard a lot about what was going on behind the scenes at SASA during the initial phases and development of this grant. Perhaps talk to us a little bit about that and how it has evolved with time.
Thanks, Kathy. And I think this has been, as the CEO mentioned, a very interesting period for us as we, in a very short space of time, had to put something together responding to a pandemic. Most of our services were shut down, as Dr. Magasela mentioned in his research. And we literally had to do something we never did before, and there was a need to think out of the box. I think the CEO mentioned on an average, SASSA takes about 1.2 million applications in any given year. And in that first year when we implemented the COVID Srd grant, we managed to reach about 6 million people in as little as 3 months. So within 3 months, we've reached 6 million people. But beyond that, and I think probably what wasn't mentioned today as well, we also implemented various top-ups on our existing social grants. So that was sort of our main activity for the first 6 months, was to say, how do we get to the most people in the quickest and the shortest period of time? And the easiest way was just to top up the existing grants. Major shortcoming in the system was that we didn't have grants that goes to the 18 to 59 group, but we had grants that went to the elderly, to people with disabilities, and for children, which are a huge part. So as Dr. Magasela, for example, mentioned, the profile of the poor is largely that particular group, children, women in rural areas with children. And so we could target that group quite quickly, quite easily, by just increasing the value of the social grants. So of the sort of 50 billion rand package, that was probably about 30 billion rands that went to that group. And then we had to implement this COVID Srd 350 grant, which was mainly then aimed at reaching the people who were outside of the existing social grant framework. Now, all of that, again, and I think SASSA did an excellent job here, had to be done with systems that were not geared for reaching that amount of people in that space of time. And SASSA essentially had to build the system, implement the system at the same time, and while implementing, test the system, refine the system, and continue to make improvements to it. And even in today, I mean, normally we take 3 or 4 years to build systems, test them properly before we implement them. So even as in the second iteration of the grant, we're still doing development work, we're still doing, and so the system isn't perfect. I think if this grant goes forward, and I think there's substantial evidence that this grant should go forward, we will be in this sort of teething phase probably for the next year or two until we can get it to settle down. So I think for me, one of the things that probably gives me the most sleepless nights is, under ordinary circumstances, and this is something Dr. Magasela raised, government is allowed to progressively realize a right. For example, in the child support grant, we did it with age categories. We first said 0 to 7, and we eventually went 0 to 9, 14, all the way up to 18. Yeah, and that was acceptable. You were excluding people based on age. Here we're almost excluding people based on administrative systems that are trying to catch up. And whether that is an acceptable form of progressive realization, noting that, in fact, it's a better form in the sense that we've reached the bulk of the people that we're supposed to reach in this particular cohort, but it's really going that last mile of saying, how does one get to the groups that, for example, are digitally excluded, and to those that are not on, or they're having challenges with some of the databases and the administrative parts. And would that just be seen as, from an administrative point, you can't realize using that, because that almost then, that puts us in a difficult position as government when we say, come April next year, do we decide, well, okay, noting we can't immediately get to everybody, do we take another route and plan a whole new process of progressive realization, or do we say, well, let's just keep pushing this route and try to get these systems, etc., to work a lot better?
Apologies for that. This issue of the criteria has been a really big one, and Dr. Magazela talks about these exclusions and that have been done on error. So when it came to the criteria and how this criteria was going to be set up, what were some of the conversations that you in the department were having around it, given the fact that this is the first big technology-based program that you're having to administer?
So the first prize was universal. That would have been easy, just give it out to everybody who needs. But that was a very expensive option and a debate within government that, so even though government was implemented a very huge relief package, that was just outside of the scope of that package from an affordability point of view. So we had to target one way or the other. And the only way we could target, and really looking at, as Dr. Magazela mentioned, the unemployed or those without any forms of income, was to look at the various sort of databases that could serve as proxy indicators for these. So, for example, the first one which we thought would be very helpful was the SARS database, because that's technically a database of everyone that's paying taxes, and if you're paying taxes, you definitely are employed. But that created, from the onset, we struggled with that one, and it created a lot of, I think you call them false positives. Yes. The other one is UIF. So the other options was to exclude people that were getting other forms of government support. So we'd excluded everyone else that was getting a grant. We excluded everyone who was, for example, employed by government. So we looked at the PASEL database. We tried to and everybody that was getting UIF. That was initially problematic as well, because we got these huge UIF databases. But I think, as we've improved over time, we've now narrowed that down to only the relevant aspects. And a few smaller databases like the NSFAS database, where people are getting bursaries to study, which includes a stipend, prisons databases, and so forth. Yeah.
All right, thanks for that, Brenton. Isabel, let me come to you and give you an opportunity, again, just to reflect on the research for us before we continue with the rest of the conversation.
Thanks very much. It's really nice to be here. Nice to be with you, Kathy, and with Department of Social Development. I think, and just to say, I was part of a reference team for the research project, so I've been able to see how the team dealt with the issues coming up, and it's been quite an interesting process just seeing how, again in this time of COVID, solutions were the issues that sort of came forward. So I think for me, as someone who works a lot in the field of social security from a constitutional human rights perspective, this initiative has been incredibly exciting. As many of us know, in terms of the Constitution, everyone is guaranteed the right of access to social security and the rights to food. And I think these are the two critical aspects under the overarching right to dignity. We know that in a country where more than 1 in 2 people live below the upper bound poverty line, 1 in 4 people live in starvation, this has been a critical issue. Now, our social security system, our social grant system, in large up to now, has been the apartheid-dominated design, where working age people were excluded, because in those days there were ways in which working age people could be taken into sheltered employment under apartheid. And so I think they're just 3 issues that I want to dwell on at this opening stage in this debate, and I do hope it becomes a robust discussion. The first is universalism. I think many of the participants so far have talked about the danger of errors of exclusion. Now, in a country where, and I've already indicated that the poverty profile, unemployment, as Dr. Magazela said earlier, for younger people, 76%. We know that for those who are formally unemployed, the ability to get into employment is incredibly low, so 77% long-term unemployment. Why are we excluding? Why is our emphasis on excluding rather than including? We have a society where the dysfunction of exclusion, again, has its roots back in apartheid, where race and where you lived excluded you from accessing formal employment. And we seem to be perpetuating that. So I think we need to take a really hard look at what the values are that we're saying. We're saying that you're excluded unless from the narrow criteria that we have, we recognize you. Otherwise, your poverty is invisible to us. You don't count. And linked to that, again, one of the things that hasn't been spoken of is the fact that in the first round of social relief of distress, there was a huge policy error of exclusion of women. And that was linked, that was not a design intention, but it was, again, a design flaw because of the emphasis on exclusion of ineligible. And that was because 7 million women were receiving grants as caregivers for children in the first round of caregivers grant. When that ended, however, women were not allowed to access the social relief of distress because they were seen already as grant beneficiaries, but they were receiving grants for children. So secondly, we've got to ask the question, how are people recognized and valued? So women were recognized and valued only in their role as caregivers, not as fundamental rights holders themselves. So by designing and defining, we also exclude and we use normative judgments in terms of how people's citizenship has value. So from the research, this research, from other research and the research that my organization has done, we firmly recognize the value of universalism. And in fact, that's what the Constitution says. The second point that I wanted to talk about was the amount. To a large extent, I would say that the values that are given to people in terms of social grants are incredibly arbitrary. That the way in which the amount of financial support is given is sort of roughly divided by the budget, divided by the number of people who need it. And that's really how the child support grant was introduced in the Lund Committee report in the late 90s. We need to move towards a needs-based assessment and an indexing of the amount against that. So for instance, the 350 Rand is 56% of the food poverty line. Now the food poverty line is an amount that the World Health Organization deems to be the lowest amount required to survive. So somehow 350 is, as 56%, is seen as a logical amount of income, because don't forget, due to the means testing, you aren't entitled to any other income. So somehow you're meant to have this 350, and miracles have been created by people who are able to use it. But firstly, we need to link it and index it against a decent standard of living, which I know the Department of Social Development does have and references. Those are the kinds of debates that need to happen. And again, constitutionally, the state needs to justify where it is falling short of that. But then secondly, linked to the amount, looking at the value and the need, the objectives of policy. To my mind, the social relief of distress had two impacts. The first was humanitarian, meeting immediate needs. But the second was also to shock the economy into recovery. Now, we've heard of big headline programs that government's doing in terms of economic recovery. But if you look internationally, getting money into the hands of people is the best way to restart an economy. And we would argue that the amount of 350 Rand is really far too little to achieve both of these. So linking the amount to something which enables people not just to survive, but to thrive, to stimulate, to create, such as the upper bound poverty line of 1,335 Rand, is something that really needs to be looked at and carefully reasoned around, rather than arbitrarily connected. And I am aware that I'm eating into some of this, but I think this is really critical. The third point for me that this research raises is that of political will. What we had here was a political will from the highest decision maker in the country, the president, to say this will be done, and it was done. Now, Brenton's talked about how systems take years to develop. Many of us have been part, through NEDLAC, of a system around a green paper, which is looking at the comprehensive overhaul of social security. And that was published, and then that was withdrawn. I think we need to ask where the political will is to use this research, to use the social relief of distress, to push forward for an inclusive system which enables people in this country to realize their rights to dignity, but also citizenship. We need to make everybody economically active and to meet their basic needs. Thank you.
All right, thank you so much for that comprehensive response there, Isabel. Let me then invite Mr. Selwyn Jehoma, who is joining us virtually this morning, to give us also his input, and he's an independent consultant in social protection. Mr. Jehoma, I'm going to give you your opportunity to give us the opening remarks, and then we'll continue with the conversation and take a couple of follow-up questions from there.
Thank you so much, Kathy. And let me start by greeting the Minister, the Director General, the CEO of SASA, and colleagues who have done excellent work, research by Dr. Makasela and his team. And Brenda and Brenton, I'm sure that what you've gone through was something that one often doesn't wish for when you introduce new policies, but it is a tough terrain. And your efforts really need to be commended. In terms of the research, and Kathy, that's where I'll venture a couple of comments. I think South Africans can consider itself a proud country insofar as we implemented this benefit in this time of crisis, then we then undertook this research to shine the light upon ourselves. So this collaboration between government and researchers and civil society is what strengthens our policy making. We are acknowledging through it many mistakes we've made.
Remember, if something goes wrong, we'll hold you.
All right. Mr. Jehoma, I think we're having just a bit of difficulty in terms of hearing you clearly. The team might be trying to work on correcting that. So what I'm going to do is that I'll give them an opportunity perhaps to redial you so that you can rejoin the room and see if we can't do that on a better connection, and we'll continue getting then the rest of your inputs. So let me bring the conversation back then to the guests that are here in the physical, and I'll wait for the team just to give me an indication of when Mr. Jehoma is ready to join us again. But this idea of the divide that was created by technology, on the one hand, you hear Dr. Makasela saying, this is a new era. The provision of social security is not going to go back to where it was before this pandemic. And yet in the same breath, he says, but they've been the people who would ordinarily be the target of this kind of program that have been excluded from it. Does that not provide somewhat of an oxymoronic position, especially for the department, Brenton? When you hear some of this feedback, where do you begin? Because on the one hand, it's like really great what you've been able to get done, and on the other, it is sharing and it is exacerbating perhaps part of the inequalities that already exist and the bias and the exclusion that already exists in our society.
Thanks, Kathy. Yes, it does feel a bit like that. But I think what's important is for us to, consider the cohort of people that we aiming to support. This is your 18 to 59 group. This is what we generally call the working age population. I think tools like cell phones, and I know Isabel's got some very creative ideas around the cell phone and how one can use that as a developmental tool. And maybe she'll raise it so we can discuss it. But I think the technology is part of the development process within the country. So people who can't access technology have additional developmental needs. It's not about saying one should develop separate systems for them, but one should help them access the systems. Because if you're looking for a job, because these are people that are looking for jobs, it's better to help them, assist them to be able to access whether it's a cell phone. You can't be looking for a job if you don't have a cell phone. You can't be, most employers today are going to be using these platforms. So it's about bringing people into the platforms rather than creating an us and them platform. Yes, there will be residual, but there will be small margins. So I don't think it's going to be the sort of the large numbers that's being quoted of, say, 3-4 million people. There might be a few 100,000 people that are going to be really at the margin, and then you're going to use your social workers and your other sort of developmental instruments or services to assist those people as well. But I think what one should be focusing more on is to be able to assist people in being able to access these systems, and that will also help them access other systems. And then together, SASSA should be linking these systems with the various labor systems in the country. That makes access even a lot more easier for people to the labor market. Because ultimately the access, we don't necessarily just want to be doing, providing a grant, but we also want to be stimulating and facilitating access to the labor market as well.
Dr. Makasela, are there any specific ideas that you have about how it is that more people can be brought in? I suppose, unless everybody gets a cell phone, there needs to be other ways that need to be looked at here.
Oh, absolutely. There are initiatives that can be put in place. Now, let me start by first, in my response, raise quite importantly the point that was raised by Ms. Isabel Pryor, which is really around the right to social assistance. First, it's a right, and everybody that qualifies is entitled to it. Now, I would like to start by making reference to the following. If these were persons that some private company wanted to sell something to, that private company will reach those people. Right, let's start from that kind of premise, right? Secondly, let us then look at what SASSA itself attempted to do. SASSA did assign people at community and local level to assist those who did not have access to these digital devices, and just those who were not literate enough to utilize the system. SASSA did make those kind of attempts. Now, how do you mitigate the exclusion? That's fundamentally the question that you're asking. I would like to say that one hopes that when we speak about social assistance in the country, SASSA, by definition, needs to be in a position to know the following. In each province, in each municipality, in each district, in each ward, SASSA needs to know the levels and extent of poverty, of unemployment. You can create a very clear map using data from Statistics South Africa as well as administrative data to compile a very clear profile that will say to SASSA, yes, you may not cover everybody, but if you want to assist in terms of rural areas where poverty is deepest, this is where you go in Limpopo, this is where you go in the Eastern Cape, this is where you go in KwaZulu-Natal. In that sense and way, you will then be in a position to address the urban bias that was kind of evident in the research that was conducted. Therefore, in South Africa, when we talk about poverty incidence, where poverty is, there is research that's been done by the Human Science Research Council, ongoing surveys that are done by Statistics South Africa. There is a different kind of approaches in research that can be adopted in ensuring that those that are poor are indeed reached. So yes, there are systems that can be done to mitigate this, particularly if we start from the premise that says, one, these are fellow South Africans that we have identified. And then number two, they have the right to this money to this assistance that government is providing. Therefore, we need to make sure and find ways of addressing them. Just to end the comment that I'm making, as I did say earlier, we cannot build a system that clearly, through modeling that we've done, excludes people and then go home and fold our arms. We need to find the very core of the poor in those deep, far-flung rural areas, which we know SASSA does reach through its outreach programs, Ms. Motlatlana. SASSA has got excellent outreach programs that it undertakes to reach far-flung, deep rural areas where poverty is very severe. Social Development and SASSA have done these outreaches where they've gone to those rural kind of areas. So therefore, at the same time, we cannot then say online digital platforms and then fold our hands. Those who are out, they're out, and those who are in. We are violating the constitutional provision and the rights of those persons. Thank you.
Let's go back a little bit, Dr. Magasela, to part of what the minister said. She said that they needed a solution because as they were sending people out into the field, they found that many of their workers were getting sick due to being infected with COVID-19. And that was part of the reason why they needed to be a different type of solution. Brenton also talks about the fact that there was simply not enough money to go around if they didn't have any kind of criteria. So those are some of the realistic issues and challenges that those in the department would have been trying to navigate through at the time. What could have been done in the midst of those challenges?
Most of the people that are part of this discussion are very much aware of the challenges of policy development. We always speak of trade-offs. Now, if you say no universalism, you need to know that by taking that decision, you are then excluding those millions who qualify but cannot have access to it. Therefore, you do trade-offs. Here we are speaking of, if I may explain it this way, this is not a unique South African issue. It's global. It's been very well studied and established, the issue of the digital divide, how technology excludes. We do have South Africans, whether you like it or not, who don't know how to use cell phones. They just do not. The literacy levels are very, very low. Therefore, in answering the issue of what could have been done, one has to go back to the policy trade-offs that are built into the system. Just exactly the same manner and way in which both Mr. Brenton van Vrede and Ms. Isabel Pryor raised the issue of the exclusion of women. Women were denied access to this grant. We know very well that the child support grant is intended for the child, not the caregiver. Whereas the implementation of the 350 COVID-19 grant did allow exactly that is the exclusion of women as citizens. So if I was a man who's not a caregiver, I could get the 350. But, Kathy, you are a woman. If you were a caregiver, no, you're not entitled to the grant. Therefore, the issue of exclusion, it's not necessarily only those who were or are in rural areas. It also went into other areas such as gender, the urban bias, those who can use cell phones, the profile of people with a minimum qualification of matric, who use cell phones for education, to search for jobs, and the many other things that make this digital device to be the convenience that it is. So the long and short of it really is that it's policy trade-offs, and as well as the fact that there are mitigating interventions that can indeed be made. Thanks.
Isabel, I imagine that for somebody like yourself who's also been advocating for the introduction of a basic income grant, part of what this research tells us is the conditions of young people in this country. That 70% of young people who have a matric, who have a higher qualification, are finding themselves in this position where SASSA can verify that they have absolutely no other source of income is absolutely devastating for me, because it speaks to the sense of helplessness that the young people of this country actually find themselves in. It's not even frustration. I think it should be beyond that.
Thanks, Kathy. I think this research has just given us further pause for reflection on that point. And it's a devastating point, as you say, for many young people. And I've got a 15-year-old daughter who's struggling through school, having to do your assignments. The implicit promise is that if you do your part, society will come and give you access to a grant. We know that fundamentally, in terms of human philosophy, we want to have our children have a better life than we do. But what we're seeing in this country is a dysfunction, a complete disassociation between attempts and ability and application of self and the outcome of that. I think to shift quite radically from this idea of youth, but just to talk more generally about society, we all still carry the images of the July violent protests, where we saw people taking very irrational steps and quite violent, destructive steps, almost caught up in a frenzy of protest. To a large extent, if you add that to the daily so-called service delivery protests, it comes back to what you defined as a lack of hope. And I think that if we can't show people the kinds of ladders from where they are to where they can be, that tomorrow will be better than today, then we need to admit that the dysfunction in our society is absolute. The extent of the intervention that we need to take to bring people back into a sense of a combined purpose has to be large enough to meet that level of crisis. And that is, as you know from past experience, why we think that something as large as an intervention as a universal basic income grant is the one sure policy to ensure that nobody is excluded. I think one of the things that we also need to look at is we need to make sure that we don't just see these interventions as poverty interventions, as charitable handouts. One of the concerns that we've raised with the department, and I know that many within the department had similar concerns, was when you extend a grant for 3 months at a time, you rob that person, that recipient, of any future planning. You keep them, the recipient, on bended knee with a handout, waiting for something from government. And so in a way, you're getting different. From my perspective, my opinion is that you're getting different messages from government. On the one hand, government's saying to you, don't be dependent on us. And yet the very construct of the policy to give people the seed to be able to grow their own future is designed in a way that keeps you on bended knee, dependent on that handout. And so I think reflecting on this research going forward, there needs to be a consideration of what are the stimulants that people need to take control of their lives. I think we also need to recognize that we can no longer see social development budgets as being a cost to the state. It actually needs to be seen as an investment in the future. Because if we have everybody working and creating jobs and opportunities, then it means that these other programs, these other input stimulants from the state are worthwhile. But just if you are in a rural area, if you're in a township, and you're trying to create a livelihood, but nobody else has disposable income, it means you're set up to fail. We know that SMMEs globally have a 20% rate of success, 80% failure. And yet in South Africa, that's so much higher because there's no demand. We need to make sure that the solutions we put in place are the ones that are necessary for our country. We need to be giving people the money in order to make society work.
Let me go to Mr. Jehoma. Mr. Jehoma, I know that you are back with us and joining us again virtually. I think that the sound issue we had earlier has been sorted. So I want to give you an opportunity just to go ahead and give us some of your own reflections before we follow that up with a couple of questions.
Thank you, Kathy. Of course, as the conversation continues, some of my reflections change to avoid repetition. I think what the two colleagues raised, the issue of exclusion, the way our social grant system and our social security system is designed, presents us with a number of challenges. For balance sake, we've done extraordinarily well as a country in terms of expanding social security. We had in 2000 about 3.5 million beneficiaries. We're now exceeding 18 million. That is a coverage higher than most middle-income countries at our level have. And so there are a lot of good we've done. That doesn't mean everything is shiny and it's okay, and those problems were raised by my two colleagues. I think one of the things, and again, the approach to the research was solid, triangulating both qualitative and quantitative data, and that's good. Other than the fact that we did this ourselves as a country, we have made great strides because many countries have had to have multilateral institutions do this type of research to help them see their own mistakes and the good they've done. The one part I wish we could have included is the impact on those social grant beneficiaries, the 9,400 people who had to go out while they're already serving about 100,000 per month. Suddenly millions more needed to bring in, and the exposure they suffered and the challenges they faced. And I think consideration again in going forward, along with the recommendations, suggestions made, is how do we empower them as well, because they haven't had the benefit of skills training to the extent necessary over the years to have prepared them. But on reflection now, we can see moving into this digital welfare, as it's coined, in the midst of a fourth industrial revolution, we've got to, as Mr. Makasela said, reconsider the delivery model. And a lot of that has to start with the people that serve the people that we want to reach. Again, without wanting to repeat that, the research from the institution pointing to the utilization of the grant, again, as was indicated, this is the trend globally, where people in distress and people without income spend most of the money just to survive. I'll reserve some of my other comments till a little later unless you want to probe some more thoughts.
And perhaps let me just follow up with you while we still have you on this point of what this grant is actually used for. Given the fact that it is mainly used for food, and when we look at that basic food basket and the cost that it has been under COVID, we've seen it increase in some instances quite significantly. And this has a bearing on whether or not it remains affordable to the majority of South Africans. Do you think that this means the conversation around increasing even this 350 Rand grant needs to be taking place?
Kathy, that question, am I correct that the question was put to me? The debate around affordability is really just a distraction. It's for people who feel that we should not spend our resources and time on those who have been left behind. We need to remind ourselves that we're still sitting with a legacy, and we're often told, don't look at what happened in the past. But what we have is still under construction for a transformed and better society. And so the argument about we don't have the money just doesn't hold water, because we're in the same pot with the same gross domestic product, in which those who have benefit to the tune of more than 50 billion Rand from government subsidies on a monthly basis. There is nothing but a grant to the rich and middle income. These are issues that the minister raised before. It's unfortunate that the Green Paper came under the fire it faced only because there are vested interests. But resources is not our constraint. It's really an issue around how do we care for the young people of today and for children of the future so that we build a better future? Because to leave them behind is essentially to write a future for ourselves. Let me just add one more point to that around the access. I think, and maybe we mean the same thing, we don't really need a single citizen registry because Home Affairs is there. And I think what Mr. Makasela may have meant is a single social security registry, which would have obviated many of the mistakes we made in paying millions of rands out. This process has been supported for a single social security registry. It's been designed at a high level, it's been costed, and so nothing stops us from moving forward on that score.
Thank you for those contributions. Maybe let me bring this issue of the single registry back to you, Brenton, and and talk about what that practically has been trying to have all of these databases. You're relying on SARS, you're relying on the UIF, and some of that data is outdated. It hasn't been updated, and people are saying, you are saying I'm an UIF beneficiary, but in fact, I have not worked for the last 5 years.
Thanks, Kathy. I actually was hoping you'd put that to Selwyn, because at his time as a DDG in the Department of Social Development, that was something he spearheaded a while ago, probably about 10 years ago. And I think it was a great initiative at the time, and if we got it to work, we would not have been in this sort of, we wouldn't have these challenges we had today. And that sort of brings me to a comment I want to make around what Dr. Magasela was mentioning, is that initiative, what started off as developing a social security register, linking departments of labor with social development, with home affairs, which is sort of what we're now trying to do again, sort of got derailed with sort of into something more of a sort of poverty tracking register, where people wanted to do profiling and trying to understand the poor, which is, I'm not saying that's what Dr. Magasela is suggesting, but you know, that just became a bigger project and just sort of fell through the cracks because it wasn't that implementable. We have had some success, we have done some profiling, but to profile all your households in the country and to keep the register updated so that it can actually be relevant and useful is something that's enormously expensive, but also just difficult to do given the kinds of resources one would have to do. But what we are seeing now is this sort of resurgence of a idea around a poverty grant vis-a-vis what we're sort of doing with the SRD grant, which is more of sort of an unemployment grant, where people are saying, well, go back and target poor areas, look, you know, and then focus and come up with a completely new grant focused at providing support to the poor, utilizing the sort of household profiling and finding out who the poor is, etc. Versus sort of the other alternative idea, which is saying, well, let us approach it from a social security perspective, where we're looking at one of the contingencies or risks that you need to mitigate within the social security space is unemployment. And then developing a benefit that is sort of aligned with your, you always want to align your social assistance, social insurance benefits. So you have a UIF, which provides an unemployment benefit to formerly employed people, and you want a similar social assistance benefit that can cover the gaps that UIF doesn't cover. And then obviously linking both of those to active labor market strategies and approaching it more from an unemployment perspective than a sort of a pure poverty perspective. And that's a raging debate that's going on at the moment, and probably something we'll be discussing in depth in our next webinar series. Thanks.
All right, thanks for that. Isabel?
Thank you. I think that some of the points that Brenton raised, and Selwyn as well, are really crucial. we need to understand the extent to which our policies need to be informed by empirical evidence. I think the richness of the report that is being launched today should not be forgotten. Now, what Brenton's talking about is the possibility of policies being made which don't seem to be informed by these findings. The idea that's being driven through the presidency of a household-targeted poverty alleviation grant seem to be taking us backwards rather than building on this evidence that we have before us. If we're wanting to ensure that people are trapped in poverty, then we go for a targeting of a grant that is a poverty grant. We know from this research that means testing is a way of ensuring that people don't take the initiative. Because if you take the initiative and you start generating income, that means that you lose the grant, your only reliable income. We need to be creating an entrepreneurial population. We need to be saying that we will give an input, and for that, which you can then use to multiply, both as a community and of course as individuals. The other aspect, which I think is just really important to recognize from this research, is the role of targeting individuals versus households. From other research, and Dr. Magasela was saying at the beginning, we must be mindful of the wealth of research that exists. We know that if money goes into households, the dynamics of the household are quite complex. Frequently, women and older people are excluded from accessing the benefit that comes in because of some of the patriarchal norms that we still have. And so we need to be mindful of that. What are we saying that we're taking people back into a system rather than emancipating people through that? But the other point that I wanted to raise about the access of the state, and it's something that Brenton alluded to previously, that within SPY we've been talking about the exploration of using smartphones as a point of access. Now, I know this is not what Dr. Magas, I think that probably Wiseman and I would have a good conversation about this offline, but as we advance through the technological divides, we need to be looking at ways in which we can be leapfrogging. Now, if there's a distance between the state and individuals, how better to narrow that distance, but by making sure that everybody has access and that the state has access. So if we're wanting to give SMSs about vaccination, that would come on a device. If children are not able to attend school, we could download and make sure that access to the syllabus is there. But on the other hand, the state, I would then argue, would have an obligation to make sure that everyone has access to that technology, whether it's through a smartphone or another device, as has been done in many Latin American countries. We could start creating and manufacturing that smartphone. Because if everybody's got the same smartphone, there's no point in stealing it. So we can also reduce the burden on the police, because we know that a lot of the police time is filling out insurance claims for smartphones.
Yeah, I don't know, Isabel. Go ask Missy Panyaza Lisufi what happened with those iPads, right? All of the kids had the same iPad, but unfortunately, yeah, we've got some bigger societal issues that I think we need to deal with on that front. Dr. Magasula, before I come to you lastly, just to everybody else who's joining our program today, I will be opening up the session to take question and answers from those who are joining us as participants in today's conversation, and I'll be doing that shortly. So if you can go ahead and pop some of the questions that you may have in the chat box. Lumka and Nomfundo are standing by to actually start going through them, and we'll be taking those questions after this final round of comments. What has happened? Do we know what has happened to those people that were excluded, those that qualified but did not receive the grant? And let's talk about some of the recommendations that you might have in reaching those people, because that could be and is important for any future changes that could be made to this project.
No, thank you for that. In terms of some of the recommendations that have been made, looking particularly at the one around a single social security register in South Africa, the important point to make is the following. We need systems that are fit for purpose. What the COVID-19 grant demonstrated quite clearly is that we are not at a point where we have across government systems that are fit for purpose, because those systems need to be interoperable. They need to talk to one another, as we often say. And it's quite clear that when a call was made to the UIF database, there were challenges that were quite evident in that regard. Also, which is even more important, how do you prove that you are not earning an income? When in this instance, in the application, one of the ways in which people were evaluated was that SASSA checked their bank accounts. So if you received 250 Rand from your friend, your mother, your grandmother, you did not get the SRD grant that month because there was some income that went into your account, regardless of what the purpose of that income was. So there was a very, very stringent application of that kind of criteria. Now, if you then ask me what happened to those people, I'm going to say to you, one, what we need to understand within our context in South Africa is the following. One, there are no jobs, which is why you have 70% of our young people who are under 35 years applying for this grant. There are no jobs. The answer that we need to provide to the question, and the question is this: what do we expect those South Africans who do not have jobs to do? What do we expect them to do? What do we expect them to eat? Where do we expect them to find the resources to buy food when there are no jobs? Now, that is the fundamental question really around the issue one that are raised in this research, the 350 and the assistance that it provided. But it extends in a very, very important way and in a very fundamental way around the questions of a basic income grant. You cannot avoid that question because there are no jobs. Now, I may also go further and say that that is why, as a country that has a developed economy that we have, we still have very, very high levels of stunted growth amongst children, very, very concerning levels of malnutrition within our population, because there are no jobs and because there is no income. Maybe just to punctuate my contribution at this point, I would also like to say to all of us here, because reference has been made to research that's been undertaken before, we have research that clearly indicates that social grants do not prevent South Africans from looking for jobs. They absolutely do not. I mean, there is research that has accumulated over a period. The payment of social grants is not a disincentive for people to look for jobs. In actual fact, research that we have undertaken previously indicates that jobs and income accord people dignity within communities, within their families. There is no young person, there is no man or women in South Africa that's going to say to you, I want to live off a social grant. However, what we often find is the repeated mention of grants cost dependency. Kathy, about 90% of South African social grants are paid to children who can't work and are not expected to work. Also to older persons who can't work, who've reached pensionable age and are not expected to work. That is the significant proportion of grants that are paid. You cannot expect those people to go and look for jobs. So we do not have in South Africa a social security safety net that covers those who are facing this calamity, that there are no jobs in the South African labor market. There are volumes and volumes of research, one piece of research after another that is saying unemployment in South Africa is a very, very heavy, serious problem. Kathy, when you asked me what has happened to those who were excluded, they can't buy food. They can't, even with the kind of constitution that we have, they cannot fulfill the basic fundamentals of being a citizen in South Africa. That is basically the kind of situation and circumstance that we are dealing with. Now, not necessarily for this session, what are the political implications for the future of this country? Again, I'm sorry, I said I'm punctuating, but I think this is an opportune time to mention the following point. If 70% of our young people are unemployed, let's take this to 10 years from now. Who is going to be paying taxes to provide all the various different forms of social protection in the country? If 70% or more than 74% of our young people in 2020, because the research was done, I would like to believe, last year, even the one that from Statistics South Africa, if 74% of young people are not earning an income, what is going to be the shape of South Africa 10 years from now? If we continue having 75% of young people at their prime, where they're supposed to be contributing to the prosperity of the country, but are not able to. So this idea that social grants or the 350 cannot be extended to a basic income grant, it's based on a misunderstanding, on a blindness, almost one should say, and a total disregard of the overwhelming evidence that says, one, grants do contribute positively in our society, and secondly, the only reason people are applying for social grants is because they don't have jobs. If they had jobs, they will not apply for social grants. Therefore, you cannot, as a country, as a government and the state, deny them both. You can't deny them jobs and also deny them social grants. That is untenable. If you're not able to provide jobs, then you need to provide social grants. Because the day we are able to provide jobs for our young people will be the day we will have far, far less demands for social grants. Thank you.
Dr. Magasela, thank you so much for that. So, Jerome, I haven't given you an opportunity to weigh in a bit. So before I open up for the questions that are coming through from some of our other colleagues, anything that you wanted to add?
Jerome Selwyn, yes, and me?
Yes.
I share the sentiments expressed by Mr. Magasela. I think again here for balance, I am very positive because the future may not get better, but we have opportunities to make the future better. And our way to predict it is to create it. The future of social security is essentially, and is being said by multilateral institutions, it will grow worldwide as jobs, when work is redefined, we're going to have to support more. So how do we do that? By generating more income. and it can be done, as Isabel has indicated, if we, as the studies and economics of it has shown, is that if we give income to people, they spend it at a local level and they build local economies other than building their own human resource capacity. We do have the geographical maps of where people are, and many of them are also in urban areas and suffering, and so we can reach out to them. I am convinced that government policy will be adjusted and put it into the future. We need to revisit the norms and standards that we have. And the idea of giving cell phones to people are not far-fetched. If we build offices and we put out staff in the rural areas, replacing it with a telephone to people could be even more cost-effective. In changing the model of going forward, SASSA needs to think more of linking, as was said, the benefit to people's activation, because we can't rely on three departments who are responsible for generating the jobs. That's the National Treasury, the Department of Business Enterprises, and the Department of Labor. As is indicated, they will find it difficult and or impossible as the global economy is changing and robotics and robotic process automation takes over. We've got to think of how we deploy our human resources in these institutions to serve people better. So to conclude, I'm positive. I think we just need to move faster with many of the things that we have already decided as part of our strategic plans within DSD, within SASSA, within UIF, and all 5 of these agencies, I should say, spend less than 1% on training their staff for the future. That is going to prove critical and important. Thank you.
All right, thank you so much for that, Mr. Jehoma. Let me come back then to the floor. Colleagues Lumka and Nomfundo are standing by just to bring some of the questions that others are bringing through. And of course, as always, if you can just please direct and let us know who you're directing your questions to specifically. Otherwise, we'll have to gauge exactly who on who of the panelists rather will be able to take your questions up. Lumka?
Thank you, Kathy. We mainly have comments from people, and I've also just asked those who want direct access and want to know what's happening to their applications. They can just send it to us so that we can be able to answer them. But here is Israel Nkuna. He says the problems people come up against when their applications are rejected and they appeal for consideration. I can describe 2 cases which paint the picture of the helpless state many South Africans are left in by the SRD application system. The first of these successfully applied for the grant when it was first introduced in May 2020. Since then, he's received just 4 payments. The SASSA system is meant to give successful applicants notice of forthcoming pay dates, but this applicant has received none. Despite his queries and mine on his behalf of SASSA, there has been no explanation as to where the 17 payments ended up. The second case involves someone who has applied successfully when the SRD grant was first introduced. Unfortunately, the bank account details he provided initially were for an account that has been closed. I advise this applicant to open a new account and help him change his banking details on the SASSA system. However, SASSA insists the first bank account is still in act. I think it's still open. That's what he was trying to say. But most of what Israel is asking us is just specific cases, which I've also asked him to please send to us so that we can be able to resolve them. Thank you.
All right, thank you for that. Is there anything from Nomfundo?
Yes. Good morning, colleagues. I've got a couple, but they're very similar to those that Lumka has. For example, Ndo Shumani Nemasula says, SASSA never answer their phone, and we've got problems. How else do we get their attention? Bayanda Sianda Ndlovu says, my 350 Rand grant was cancelled without any notification in August. Why is this? Sabata Hlongwane, Uti, I've been approved for 3 months, August, September, and October, but I've not received my payment. What is going on? Thank you.
All right, thank you so much for those responses. Brenton, I think they probably fall largely on you.
Thanks. I think, as Lumka mentioned, many of the questions are very specific to individuals, and if Lumka mentioned, we'll probably be taking their contact details to try and figure out what went wrong. But I think maybe based on the sort of discussions we made, so that does bring this sort of interesting challenge that we've been putting forward. We're building the system. There's huge capacity constraints. We have limited resources. Where do you put your capacity first? So for us, I think the first line of entry is almost stable. What we do have a big problem with is the appeals, which for me almost shouldn't be an appeal system. It should just be a second screening process. And we probably have to build a third screening process in before you say to the person, I can't assess you, you have to come into the office to do a normal application. And so that's probably the kind of system one wants to build, where you want to reach, and I'm talking in a non-universal space. I know universal solves a lot of that, but if you're not going to do universal, you need to do the screening. You want to do your screening in such a way that 80 to 90% of your people, it's easy, right? They're just going to get it. They're going to be on no system. They're probably going to be your most vulnerable people anyway, because they're off the grid. They're not on any database of any government, which means they probably don't have much access to services. And so they're the ones that's just going to get it easy. There's going to be those that are on the grid, but may have fallen off the grid, and you can't quite tell from the databases. And so you're going to have to put further screening in place, which hopefully makes it easier. But then there are going to be those that's just, well, we just can't tell, and therefore we need to do the face-to-face interview, like a normal grant application. So that's one thing. I think we really need to be with the resources, and SASSA doesn't have that much resources. The next line of investment is in that, what we now call an appeals process, but probably just has to alter that to be another sort of screening process. And then what is really constrained, which maybe the CEO, if she wants to, can speak to, is we suddenly got 8 million new clients. We had 12 million before. We now have 8 million, more than 8 million new. So we've gone from 12 million to 20 million, and we have to communicate with them regularly. And so you can imagine the capacity constraint that we have in that. And so that's probably sort of, with the limited resources we have, the next level of investment is improve the communication systems. And that's probably why you're seeing some of these kinds of frustrations. And so I think that's probably, CEO, where we would have to focus our next round of resources to say, we've got to improve that level of communication with our people.
Thank you so much for that, Brenton. In fact, as you're mentioning the CEO, I'm going to give an opportunity as well. Perhaps if somebody can please get a mic to her. I don't see a microphone in front of her. Thank you so much, sir. Just to give an opportunity to respond to some of the questions and the comments that were made. But I think you've also been listening to this conversation, and there might be a bit that you want to say from the side of SASSA.
Thank you very much. This dialogue has been very insightful, and I think we need to continue with the dialogue. It should not be a once-off, because I think that's the challenge that we have. We start stuff and then it falls off, but the dialogue needs to continue, because that's the only way we can continue to grow. The one thing that I found interesting, I mean, I'll get back to responding to Mr. Nguna's queries, is the issue of the fact that our model can't remain to be what it used to be. I think the key is for us to make sure that in areas where people don't have access to technology and travel long distances, that's where we need to be in terms of creating infrastructure, than creating infrastructure which we can use differently in areas where there is a capacity and people can use other means. On the issue of the people whose grants have been paid, we found that the bank account was closed, and we now need to restart the process for them to access their money again. I think the key is for us as a country to look at other channels, because mobile technology, I think, makes it much easier for people to actually access their money rather than constantly looking at bank accounts. And I think that's the opportunity that we have as a country. We had a challenge in terms of paying people through mobile platform currently because of just the risk mitigators that we needed to look at as demanded by National Treasury to make sure that we don't pay on wrong cell phones where people may not have been recorded. So I think that's the opportunity we have to find a interoperable cell phone platform where people can be paid without necessarily going through a bank account. That's the opportunity that we have. But for all those people that did not get their fund where we actually had paid into those accounts, the minister fortunately has since approved, and the new regulations that have just been approved is that we can still pay that money back. We continue to engage with the post office where people whose money has already been paid into the post office account they have not been able to access. The exciting opportunity is that Postbank now has got other channels other than going inside the post office where you can go to retailers and be able to get your money. And the future opportunities that they are looking at is ensuring that people can actually get money close to where they are by making sure that there's also access in the townships, in the local economies that we need to continue to build with the money that is coming from government, because that's the area that I think we have not addressed as a country over a very long time. So Mr. Nkuna, we know him very well. He knows exactly what's happening with the issues that he's raised, and will continue to engage with him and engage with those clients that have been paid but cannot access their money. And we continue to improve on the communication to make sure that we communicate directly with the client in terms of sending them information on what is going on in their account. But we need to continue to engage. Thank you.
Thank you so much for that contribution. We're coming towards the end of our conversation for this morning, and before we do the ceremonial handover of the report, I just wanted to give my panelists one last take on the conversation for today, in case there's anything else that they felt they wanted to say before we wrap up this talk. So Isabel, let me kick off with you, and I'll then go to the rest of our panelists.
Thanks very much. I was struck by what Wiseman was saying in response to your question of what is the fate of those people who've been rejected. And I think that stark point of where are people to get food, where are women to get sanitary products, all sorts of innate aspects of life need to be recognized. I think when we hear from the private sector, when we hear from National Treasury, that things are not affordable, we need to be asking where the burden of that affordability lies. If for the majority of people in this country to live is not affordable, what does that mean about our failure as people who have the ability to contribute to decisions that will be different? So I think this research is incredibly timely and needs to be taken up at a cabinet level in order to inform some of the decisions going forward. I do also want to suggest to the Department of Social Development that possibly the Department of Small Business should be your main ally, together with the Department of, or the Minister of Employment and Labour, because those are the things that we're saying. If grants are the ability or the springboard to economic inclusion, what are the kinds of conversations that can be happening proactively? In fact, I was speaking to somebody who, until fairly recently, was not a believer in the basic income grant, someone in the private sector. What he said was, well, the basic income grant should be seen as a stabilizer of the disruption within our society right now, while we allow these other policies to come on in place. And I think that that's critical. But finally, I do want to suggest that the private sector, as a main part of our society, needs to be on these platforms as well. When we hear that